Placenta Abruption.
Hey, welcome to Bonnie's Perspective on Health. Just like placenta praevium, placenta abruption is a leading cause of antepartum hemorrhage, that is bleeding in pregnancy, as well as postpartum hemorrhage, bleeding after giving birth, a few minutes after giving birth or even after days. Placenta abruption or abruptio placentae or placenta abruption is the separation of the placenta from the uterus before time of birth. It is a sudden separation of the placenta from the uterine walls before labor. Yes. Actually, the placenta should separate after the baby is born. So before that, when the placenta separates, we call it placenta abruption. It is a very fetal condition. It is very dangerous because remember, the placenta is supposed to be nourishing the baby with nutrients and oxygen and everything. And when it separates, the baby's health is compromised as well as maternal health, because when it separates, bleeding occurs. Now, it is very deadly that sometimes the bleeding is actually concealed. There is partial separation or even complete separation of the placenta before time. Mostly it happens in the third trimester of pregnancy. The causes are very much unknown. Of course, there may be trauma, like a fall or something, but there are conditions that put you at a risk of having placenta abruption. The first condition is hypertensive disorders. Hypertension, including preeclampsia that I talked about in my other video. It is dangerous that it can lead to that condition, to placenta abruption. Another condition is, of course, when we had a previous placenta abruption, it is also likely. When you're smoking, when you're using drugs, I don't want to mention, I don't know if TikTok is okay with mentioning those drugs. Drugs, smoking, it could also cause that. And another risk factor, there are the normal risk factors of if the mother is of, a higher age, above 35, that's just a small risk. But it is a fetal condition. How it presents is you get pain. There is pain, sudden pain. And then there is bleeding per vagina. Now this bleeding, sometimes it's not bright red like in placenta previa. It is a little dark, because sometimes, like I said, it separates, then after you can get the blood. When the placenta especially is implanted like posteriorly, somehow. The most difficult part is sometimes you don't even see the blood per vagina because it is concealed. Somehow the way the baby is positioned in the womb, it somehow like covers that blood, it keeps down or behind the baby and you don't see it. But there is pain in the abdomen. You could also get like contraction like pains. Okay? Then the abdomen will also feel rigid or soft when you touch. Then we are dealing with placenta abruption. It is very annoying because you are losing too much blood. The baby is also losing the nourishment, and you're getting anemic. But you're not seeing the blood, but the pain is also there. So in case you notice that, please come to the hospital as soon as possible. Placenta abruption can be managed, of course, by assessing, first of all, what is happening. We want to assess and see how much of the placenta has separated. Maybe if it is small and we can say that from this one that is still attached, the baby is getting some nutrients, they could give you some bed rest as they observe. But in most cases, we want to evict the baby as soon as possible to save your life, very important, and also the life of the baby. Of course, we deliver by cesarean section. Now, it cannot be prevented whatsoever. You can't I am preventing placenta abruption. But in case it happens, we know what to do. But also, you shouldn't put yourself on a risk. You should avoid smoking when pregnant. You should avoid using the drugs when pregnant. It has very fetal complications, including preterm labor and preterm birth, including loss of the baby, unfortunately, but it can also lead to maternal death. So in case you observe such signs, rush to the hospital as soon as possible. There are other complications like being anemic after the delivery. In most cases, like I said, it leads to postpartum hemorrhage or bleeding after birth, which has very many causes, including uterine atony, and in most cases, you find yourself, you've even lost the uterus just from that one trigger. Mothers out there, be on alert. Know these things. Information is power. Knowledge is power. Be on the watch. If your neighbor or your friend is feeling those symptoms, or you yourself, rush to the hospital as fast as possible. Bye. Thanks for watching today.